My name's Riley Dixon, and I'm an accelerated nursing student here at the UNC School of Nursing. This semester, we've been working on 6 West to do a QI project to improve nurse communication with our patients. Nurse communication is an integral part of the patient experience, and we really wanted to come up with simple interventions that nurses could apply with their patients quickly and effectively. So we all know that nurses are extremely busy day to day with large patient loads, and they may not always feel like they have the time to adequately communicate with each patient. However, evidence shows that it only takes 56 seconds to form a connection with the patient. And that being said, one way that can easily be added is that if we ask our patients that we can sit at the bedside when we're communicating with them. This makes patients feel like we really have the time to talk with them, and also puts the nurse at the patient's level so they feel more respected and understood. Now let's see a scene that demonstrates sitting and communicating with the patient.
Hi, I'm Elizabeth, and I'm going to go get report on my patient. It's change of shift at 7 p.m., so we're going to go find out how Miss Smith is doing.
Hi, Miss Smith. This is Elizabeth, and she's going to be your nurse this evening, okay?
Okay.
So I'm just going to give her a report really quickly, and if I miss any information or if there's anything you want us to know, please let us know, okay?
Okay.
So this is Miss Smith. She came to us around 3 p.m. today. She has a new ostomy, which we had to remove some intestines related to her Crohn's disease. She's currently NPO, just some clear fluids. When she first came to us at 3, her pain was rated a 3 out of 10, just directly at the site. So we gave her some Tylenol, and then about 45 minutes later, she came back and her pain was at a 0. Are we still pain-free right now?
Yeah, it's about a 0. I'm just sore.
Yeah, okay. So is there anything else you need from me right now?
I don't think so. Thanks, Riley.
All right, Miss Smith, hope you have a great night.
Miss Smith, do you mind if I pull up a chair and sit with you for a minute?
Yeah, that's fine.
All right. So I'm just going to go over the general plan for the evening. So I still have to get report on my other patients and just check in with them. And then I will come back in about an hour probably just to do your assessment and give your nighttime medications.
Okay, sounds good.
Yeah, but before I do that, I just wanted to check in and see how you were feeling, how you were dealing with everything.
I'm good. Overall, I mean, I'm just, kind of nervous because it's going to take a lot of adjustments getting used to this. But other than being hungry and pretty tired, I'm okay.
Yeah, so like we said, right now you're still going to be on liquids only. When I do your assessment, I'll check in and see how you're doing and talk to the team, and we'll get you some food as soon as we can.
Okay, that'd be great.
Yeah, okay. Is there anything else that I can do for you tonight?
Like, if at all possible, I know it's really out of your control, but I'd really like to get some rest.
Of course, yes. I'll do
Yeah.
my best to consolidate your care and make sure that we're not interrupting you too much. But if you need anything, if you're in pain, please hit your call bell right here,
Okay.
and we'll help you as soon as we can, okay?
Okay.
All right, I'll be back in about an hour, Miss
All
Smith.
right, sounds good.
Another intervention we would like the nurses to try is to utilize active listening. This is just a form of communication that allows for nurses to be more present when working with patients. Some of the key points of active listening are being attentive. This can include sitting at the bedside or making sure we're making eye contact with our patients, utilizing open-ended questions, requesting clarification if we don't understand something, paraphrasing, recognizing and validating feelings, as well as summarizing to make sure we got all of the key points and key things we need to know to help our patients stay. And then if you're struggling to come up with questions to ask, you can always remember the acronym BATHE, which stands for background. You could ask a question, just have the patient say, or ask the patient, tell me something about your life. Affect, be an example of, how has this procedure affected you? Troubles, what's troubling you about this procedure? Handling, how are you able to handle this procedure, or how have you been handling it so far? And empathetic, say, this sounds like it's really challenging for you, and we'll make sure we're here to support you and give you necessary resources. So this acronym can be utilized within the active listening to make sure that we're really present with our patients and able to let them know that they are heard, understood, and can communicate with their nurses.
All right, Miss Smith, everything looks good with your assessment. Do you mind if I sit with you again?
Yeah, that's fine.
Okay, I just wanted to check in with how you're handling everything.
Pretty good considering the circumstances. I'm just kind of worried about how I'm gonna, incorporate all these changes into my life, and it's gonna take a lot of getting used to, I know. So, it's kind of stressful.
Yeah, I can understand that. It's definitely a concern that a lot of our patients have. Is there anything that's troubling you most?
Just like my body image, you know, and the smell and being out in public and needing to change it. You know, I just don't want it to change how I live day to day, and you know, I really don't want it to affect like my confidence, and yeah, so I know it'll probably take time. I don't know.
Yeah, I hear that you're concerned about, you know, it is a big change in your life, and
Yeah.
there's definitely, people will get back to a normal life. It's just a big adjustment, and it will, you know, take a lot of time probably to get more comfortable with it, and people definitely do all of their normal activities. It's just something you do have to get used to. But I hear you're worried about that, and we'll definitely go over some more resources when I change your ostomy bag later about ways we can address some confidence and body image issues. I understand how you're feeling, and yeah, we'll get there.
Yeah, I just want, you know, my family is gonna they're gonna have to accept it too, and you know, support. I really want their support, and so that's gonna be hard too. Like, you know, I have small kids, and I don't want them to see me different. You know.
Definitely. All right. Well, like I said, when we come back and do your changing it later and go over some teaching instructions, I'll get some resources together for you, and we can talk more about your concerns.
Okay. Thanks.
The third intervention we encourage nurses to use is the teach back or show me method. This is an informal way to make sure that you're communicating well with your patients and that they understand the information that you're giving them. So first, you're going to teach the new concept or skill and make sure that a patient can repeat back in their own words or demonstrate that skill. That's the teach back portion of this method. Then you're going to clarify or correct any misunderstood information and make sure that the patient can repeat the corrected information to you. Encourage the patient to ask questions and continue this process until the new concept or skill is understood. Remember to encourage questions, use plain language, and limit teaching to 3 to 5 concepts.
All right, Miss Smith. So the nurse yesterday told me that she did the process of changing the ostomy bag and talked you through everything and all of the steps.
Yeah.
She said you seem to understand everything really well. So today we're going to move forward, and I want you to teach and show me how you're going to change your ostomy bag. I'll be here every step of the way if you need any help or have any questions, and I'm here to support you because I really think that you're doing a great job, and we really want to encourage you to take this into your own hands so that you can do this once you get out of the hospital. Okay?
All right. Sounds good.
Yeah.
I'll try my best.
Yeah, of course. That's all we can ask. So we have some gloves if you want them. Since it's your stoma, it's completely your call. And then, all right, you know what to do with this? Can you show me from here?
Yes. So I guess the first thing, I'll put these on just in case.
Yeah, of course.
So we just cleaned the area and everything and dried it.
Did.
I'm gonna lay out this pad, I guess, in case,
I say, why would we want to use a pad, maybe?
in case there's any leakage.
Yeah, it's just, it helps protect the rest of your skin, because maybe you're doing this, you know, after you just got out of the shower and you're already clean. We don't want to have any leakage and then you're dirty all over again.
Yeah.
So
in the bed in this case.
Exactly.
Yeah. Okay, so I have the pad down. The next thing I'll do is use the adhesive remover, right?
Yeah, since we just washed it off, we don't necessarily need to use any more of that because we already have the adhesive removed. But say the next time you're changing it, if you notice there's some like black sticky stuff still around from this adhesive, then that's exactly what you would use that for.
Okay.
But so I think we're okay for today
Double
since
check.
we already cleaned. Yeah, of
Yeah.
course.
Okay, it looks good. So the next thing I do is measure my stoma to make sure it fits around. So I'm gonna kind of put it here and gauge. Looks like it's about 32 millimeters.
Yeah, that looks great.
Okay. And then I can cut around it.
Let's be careful with those scissors now. We don't want them to cut our hand. Perfect. And so what's something important we want to make sure when we're cutting it that we don't do? You were just, it's okay. You actually just did it. We don't want to make sure we don't puncture the bag. So it's a great idea to pull that bag away. That was
Okay.
great, yeah.
Yes, that would be bad. Okay, so I'm cutting around. I can put it on, I'll need to use the skin prep.
That's correct.
Okay, so take this out,
I'll collect your trash for you.
put it on.
Let's make sure. Yeah. So you want to
All
make sure you wipe
around.
all around the skin. We don't need to wipe this on the stoma itself. That's right, but all around our skin. Perfect. You can leave that in here.
Alright. Now, I have to clip the bag.
You can clip
Before
it
I
either
put it
one,
on.
whichever is more comfortable or easier for you.
Do it now. Just 'cause it's
Perfect.
easier.
Yeah.
Okay, clip the bag. It's hard with gloves on.
I know. Yeah.
Does that look okay?
And we want to make sure, yes, and we want to make sure we get that clip all the way shut because since we definitely don't want any leakage and it should make a clicking noise. There we go. And you'll see that that little tab is over the top, so it's not going to open anymore.
Okay. Now, I can remove the,
Just that one first.
Mhm.
That's right.
place it over here.
Perfect. I'm going to hold it down, press it down. It's great. Yep.
And then remove the outer.
Yes. And so as you remove the outer, let's just make sure, let's pause really quick. So as you remove the outer, make sure we're then running our finger along that adhesive line that we just created to make sure we have a good seal.
Okay.
So go ahead and do the other side. Might be easier to start at the top, yeah. There you go. Perfect. Yeah, make sure you follow it all the way around. Good. That's great. So then you can reset your clothing. Make sure you're comfortable.
Okay. Yeah, I feel a
Looks
little more
great. You
comfortable.
feel alright with that? Yeah.
It's gonna take a few more
Mhm.
tries, I know, but.
And then next time, maybe if you're when you're in the shower here, you can go ahead and do it then because that'll be more what you do in your day-to-day life, and so it'll be.
Okay.
It's also a lot easier when you're standing up. So I think you'll find it much more comfortable.
Okay.
But great job.
Thank you.
Yeah.